talk about biosecurity, and then we're going to segue into some diseases. I wanted to mix up my my presentation a little bit this year so that if there was any students that had attended, especially because I've done Claremont, I've done Henry Williams Defiance for the last several years, I want to throw some new stuff in there so you don't have to stare at the exact same stuff. So hopefully we will have some shows this year, and we talked about in the past high path avian influenza. Highly pathogenic is what I mean when I say that, and that's always a worry that we have here in Ohio, because Ohio has a tremendous poultry industry, right? The agriculture industry is the #1 industry in Ohio, and poultry makes up a huge component of it. We are pretty high up in multiple different things, including egg production and broilers and things like that. And that outbreak that we had back in 2014, 2015 was a pretty devastating one. We haven't heard a lot about high path avian influenza since that time, but it's still out there. What happened was, as a result of that outbreak, the industry here in Ohio and in the surrounding states, they developed their own biosecurity principles to try to make sure that they keep that viral disease out of their barns. We have found that if we apply biosecurity principles correctly, we really can do a great job of minimizing disease entry into our flock or our herd, even if your flock is one bird or your herd is one animal. So believe it or not, there's actually been high path avian influenza discovered in the United States. And here's one, there was actually one in 2020 right here that did not spread. And there was another one in 2017 that did not spread. And the reason is industry learned an important lesson back in the original major outbreak, and that is if you take biosecurity seriously and you really make a plan and you implement that, you can prevent disease in your flock. But these diseases are all over the world still, and we have to stay vigilant to make sure that we don't have anything come in to our country. Right now, there are a number of different hotspot outbreaks all over the place where disease is present in different flocks. And by maintaining a great sort of biosecurity armor around our industry, we have done a good job at preventing those major outbreaks. And it's difficult to do, quite honestly, because, you know, viruses can be tricky for us to prevent and to monitor. The way high path avian influenza keeps its hold out in the environment is basically you have these low pathogenic strains, which means they're going to cause some mild illness in the birds. They might actually be completely asymptomatic. And the problem is inside the wild birds, this can be carried, and then when they interact with our domestic birds, you can have a mutation into the highly pathogenic avian influenza strain. And the problem that we have when we see a disease in some other location is, especially with birds, they can travel tremendous distances in a fairly short period of time. And we're actually in a migratory period right now here in spring. And so you might see evidence of a disease thousands and thousands of miles away, but those birds can potentially interact with birds that we have here in Ohio, because birds love Ohio. So when you take a look at the Mississippi America's Flyway, there's a number of different interaction points where birds can mingle with birds that are in different places on the earth. And they're going to fly right over Ohio. The Mississippi America's Flyway travels very close, if not right over Ohio. And birds love Ohio because Ohio has everything that birds need. We have an unbelievable habitat up north, Lake Erie. We have an unbelievable habitat down south. We have the Ohio River. We have multiple lakes all over the state. And then we basically have one giant corn and soybean field between those two things. And so Ohio is a target for birds to pass through as they do their migratory pathways. So when we talk about the basics of biosecurity and how you are going to keep your flock, even if it's just one bird, healthy, is you want to minimize interactions of potential disease transfer. And those two different modes of infection can be what's known as direct, which is some bird transmits a disease to your birds, or it can be indirect. Something else brings disease where your bird can encounter it. That might be in the coop, that might be in the run, that simply might be in the feed or any other bit of tack that you use when you're working with your birds. Unfortunately, I hate to say, the most common method for indirect transfer is usually the people. So let's talk about this for a second and how we can keep your birds safe. Right now, we have some concerns about migratory birds, and believe it or not, there are diseases that are carried by songbirds or migratory waterfowl that can be spread into your flock. And we want to minimize that potential engagement with those wild birds with your birds. And quite honestly, those wild birds want to interact with your birds because your birds are probably nice and they're super friendly, and you have what those wild birds want. You have basically bird food, and you have a habitat that is safe and inviting for them. And so think about how you would minimize any interactions with your poultry project birds to any wild birds that are out there. One way that you can minimize interactions is making sure that you purchase your birds from a NPIP approved hatchery or some place that sells NPIP approved birds. And the NPIP means the National Poultry Improvement Plan, which was established by the United States government in the 1930s to eradicate pullorum disease. I think we have pullorum antigen for testing this year, which is the first time in a long time. I'm pretty excited about that. I'm not 100% sure why we had that long of a time lapse, but we're going to have at least a little bit, although I will have you engage your 4-H educator because I'm not deeply immersed in that. But that's a pretty devastating disease, and I'm really glad that we're going to be able to do some different testing for that. It really caused high mortality in poultry back early in the turn of the last century, and everybody kept birds back then. We didn't have the same industry that we have now, so this really caused a lot of problems for people that were keeping birds for their own personal or family food security. And so by doing a series of tests, by making sure that their breeding stock are disease-free, so that you know that when you order from these NPIP approved hatcheries or other sources that engage these hatcheries, you're going to make sure that you're getting the healthiest birds that you can get, which is always the best way to make sure that you start out with a healthy flock. One of the places where we have some concerns about biosecurity is when you bring in birds that you don't know what their health status is. Because the problem with a lot of the diseases we're going to talk about in a few minutes is they can actually be inside of a bird in what's known as an asymptomatic carrier state, which means the disease is present in them. Their immune system is working to keep that disease under control. But the problem that you would have would be that when you have an interaction with a new flock or a new bird or a stressful situation or shipping or any of the things that can cause stress, that stress can decrease the immune system where you can get temporary shedding into the environment. I will say that a large number of the disease questions and disease phone calls and emails that I get from Ohio residents regarding disease outbreaks in their flock can be traced back to them bringing in new birds with unknown health status. So make sure that you have a plan in place for quarantine. Make sure you have a place that you can keep new birds that you would bring in. If you don't need to bring in new birds, I highly recommend you don't mix Aegis species or flocks together just to avoid those disease outbreaks, because they can be very devastating very quick. If you do need to add some new birds into your flock, some replacement layers, or you're going to get another batch of meat birds or something like that, just make sure that you do your best job to keep them separate from any other small flocks that you might have to minimize any potential disease spread that you have within those different flocks or intended uses of birds. So for direct transmission, here are a few key points. Address any interactions that your birds might have with wild birds. And that can be if you have a farm pond, that can be if you have an open run where they might be out ranging, if you pasture your birds or things like that. Understand that Wild birds potentially can carry disease that they might spread into your flock. Make sure you address your food storage very, very well so that you don't have any way for any of those wild birds to get in and access the feeders or the feed where they might spread disease as well. Do your best to get your birds from a place where you know that they come from the healthiest stock that you can. You will find that there are a lot of places that you can get birds. It looks like a good deal, but there's a reason that you see birds, say at the auction or something like that. Generally, if you were to go to the auction to buy, say, an animal, folks are not really selling their best animals necessarily at the auction. And so go in there with a little bit of caution, because you need to worry that the reason that maybe those birds were put into the auction would be because they had a health problem that was otherwise causing problems for that. You'll see internet sites that will have them. There's any number of places that you can get birds. You want to make sure that if you're going to bring any birds into your flock, that you are rock solid on the knowledge of their health status before you bring them in, so that you don't bring disease in and buy disease unwittingly. So indirect, generally the people. I put a fair picture up here. I am hoping that everybody gets at least some fair experience. I am hoping it tremendously for you all. I'm a huge fair fan. I kind of internally laugh when I think about the fair, because as a veterinarian, I will say that the fair is probably the biggest biosecurity disaster in the history of the planet. And if I didn't like it so much, it would make me worried. But if you think about it, right, the fair is where everybody brings their animals and they puts them in a confined space and they all walk around and then they all take them home. And that is potentially a route for disease. I'm not saying this because I want you to avoid the fair. I want everybody to go and have a wonderful fair experience this year. I am so hopeful for 2021 to be different than 2020, but keep this in mind. After you've gone to the fair, you've had a really busy day, you're coming home, you have a ton of stuff to do. You're hungry, you want to eat your food. You have homework, maybe you have to go play a sport, you got a game that you got to get to. You have to take care of the animals that you have at home, and you want to do your chores quickly that way. Realize that you can potentially be the indirect transfer of disease into your birds or any other animals that you have. So make sure that you have a plan in place where you break any transfer for that. That can be any number of different things. That can be having a set of coveralls that you change into before you work your animals. That can be a boot wash station. That can be any kind of gloves or PPE that you slip on there. Just make sure that you, when you go to work with your animals, if you've been around other animals, realize that you might have any kind of potential for disease transmission, so that you intentionally make sure that you are not the indirect biosecurity transfer of disease. And those are not hard things to do. And if you get into that practice, you are going to keep your animals at home as safe as you can be. And that doesn't even necessarily have to stop with fair. If you go visit any of your buddies and you're over there and maybe you're interacting with their livestock projects or their animals over there, realize that they might have some disease that they have kept under control, but they might be shedding into the environment. So make sure that you break that biosecurity and have that plan in place to make sure that you don't bring disease into your flock or your herd, even if your flock and herd are only one animal. The other thing I recommend that you do is this, and this is something that I had to do when I was in private practice very commonly. It would be very common for somebody to bring in, say, a litter of puppies for me to examine, and they generally would have one that is sick or acting sick, and they always wanted me to look at that one first, because that's the one that we're always worried about. The problem is if I examine and engage with the sick one first, then potentially I might actually transmit that disease to each animal that I would examine after that. But that's our natural inclination, is we want to look at the sick one first. I had to explain to the client that I was going to look at the sick one last, because I wanted to make sure that I engaged with all the healthy ones, so that I was not an indirect biosecurity transfer of disease to the healthy animals. So you work with the youngest healthy, then the oldest healthy, and then the sick last. And ideally, before you would engage with any sick one, you're going to get a PPE change. You're going to make sure that after you have worked with a sick animal, that you are practicing good biosecurity. You're disposing of any potential contaminated equipment. And it's actually a pretty good idea to have a complete, separate, easily sterilizable batch of equipment to keep with any place that you might quarantine animals or you might separate your sick animals for observation. So the veterinarian client-patient relationship, this is one of your GPP slides, and I really like this slide. The reason I like it is this is the foundation for how I would interact with my clients and my patients in order to provide good care for their animals. You absolutely have to have this in place with a veterinarian in order to do a lot of what you would want to do in terms of getting guidance or treating your animals. For example, if I have the veterinary client patient relationship in place and then someone would call me on the phone, say on a Saturday night at 8 o'clock, I am able to give them guidance because I know them. I know the animal. I know that they are going to do what's right by them because we have that relationship in place. It is what allows me to do so many things that you can't do necessarily over the phone or over the internet. I have lots of people email me and they say, please tell me how to treat my sick animal. And what they'll do is they actually simply list the signs or they send a picture, but I can't treat them. I don't have the veterinary client-patient relationship in place. All I can do is recommend that they see their veterinarian. Ideally, you want to have this in place prior to any kind of illness problems. It's always easier to engage the vet that knows you, especially on a weekend or an evening or an emergency, ahead of time by having that relationship. So this is the list of my top 10 that I get questions about. And I probably could adjust the order, but we're going to go through it. And the ones that are highlighted, 8 of the 10 are highlighted. 8 of the 10 of these diseases actually can be prevented or minimized simply by practicing excellent biosecurity. Only 2 of them are actually things that occur commonly that are independent really of biosecurity. Most of these are diseases you either buy and bring into your flock, or some other direct or indirect transmission comes into your flock and transmits to your bird. So let's go through them one at a time. Marek's disease. I get lots and lots of questions about Marek's disease. What Marek's disease is, it is a virus that induces lymphosarcoma, which is cancer within the birds. It's considered ubiquitous, meaning that the minute you bring a bird into your farm, it is considered present on all chicken farms, and it lasts in the environment for a long time. So you are basically considered your bird being exposed to this disease the minute you pull them out of the box or you put them in the barn. Very contagious. There is no treatment. Prevention, though, is pretty effective, and that prevention is vaccines at 1 day old. You can spend a few extra little bit of money. When you order birds from a hatchery, they will pre-vaccinate it before they even send them your way. I highly recommend that you do that. The two most common the most common place that the tumors grow in Marek's disease are on nerves. There's a few major nerves that are affected by this. It can also cause tumors on the spleen. The most common presentation that I see of Marek's is just like this. It looks like this bird was running over a high hurdles, but what happens is they get a tumor growth on one of the nerves that innervates the hind legs in the bird. And you can kind of see the normal one over on the right side where those are really skinny parts of that nerve plexus. And then you can see how this one is swollen. It is basically a manifestation of tumor growth on this nerve. Another place where we commonly see this occur would be the nerves that innervate the crop in the bird. And what that does is it prevents the crop from completely emptying on time. There's a number of different things that can cause this as well. They can eat weird stuff, but Marek's disease, biosecurity preventable, making sure that you don't bring animals into your environment that are unvaccinated or might be shedding the disease. There is no treatment for it. So I recommend to prevent Marek's disease within your flock that you get birds from a hatchery that can vaccinate them at 1 day old before you get them to your house. Number 2, and this is one that I'm seeing some outbreaks right now. Mycoplasma gallisepticum is a bacteria, but it's one of them weird bacteria. Mycoplasmas are a weird bacteria. They're not like regular bacteria. They're bacteria that have a little bit of kind of viral stuff that they do as well. The problem with Mycoplasma gallisepticum is it's very contagious. It affects pretty much every bird. It affects game birds, it affects backyard poultry, and even some songbirds. And so we're in that migratory season for a lot of songbirds. And in fact, I just got a picture sent to me by a client resident that they took a picture of a bird on their feeder that was I think a finch, and it was actually showing visible signs of Mycoplasma gallisepticum. What we generally see with this, so chickens are a little bit different when we talk about anatomy and species. They have several different organ systems that are really different than we have as people. One of them is reproductive, right? They lay eggs. We don't lay eggs. But one of the other ones that is really different is the upper respiratory component in terms of how their respiratory tract is. So they have lungs, but they don't have a diaphragm. So the way that they bring air in is they have to actually physically expand their chest. They also have no bones that cover over that bony sinus, like right around their eyes. So like if you were to take your fingers and you poke around your eyes, you feel that bone right underneath there. But in birds, we don't have that. And so what we see is when they get a respiratory infection, you will see swelling around the eye and maybe even some discharge around the eye. The problem with Mycoplasma gallisepticum is they can get over it, and they generally do get over it, but then they become that asymptomatic lifelong carrier where they will shed the disease when they're stressed out. And so this is prevented by biosecurity 2 ways. One is minimize your interaction with wild birds, especially songbirds, which would love to get into your chicken coop because you have chicken food in there, and that's what they like to eat as well. But 2 is make sure that you know the health status of any birds that you bring in, because this is one of those asymptomatic carrier state diseases that can sneak into your flock. And this can cause them to suffer, right? So here is swelling around the eye of this chicken, and this poor rascal is not happy. A little ocular discharge, inflamed, will get better, but then will become a shedder. All right, so I was talking about some of the different organ systems that are present in birds as relates to people, and we talked about respiratory and we talked a little bit about reproductive, but now we're going to talk about digestive. So chickens are omnivores. A lot of people tell me they think chickens are vegetarians, but they love meat. They eat insects, and insects are made out of meat. They have no teeth. They do have taste buds, a few of them. They do make saliva. So they peck at their food and it goes first into their crop, which is right sort of at the base of their neck, right where their neck meets their chest. And that's a storage organ. And then the food then moves into the proventriculus, which is more analogous to our stomach. That's where we have enzymes. And since they have no teeth, they need something that chews up their food, and that is their gizzard. And that is a muscular, heavy duty grinding organ. And then intestinal pathways move it along until it pops out the backside of the bird. And this is a normal fecal dropping in a chicken. I have it as number 3, but in some places it's number 1. Disease most common for birds is coccidia. And somebody was in here earlier asking about if this is applicable for goats or for bunny rabbits. There are 4 species that really get bugged by coccidia, no pun intended, and that is chickens, that is puppy dogs, that is bunny rabbits, and that is small ruminants, including goats. But actually coccidia affects all species, although it's species specific. So people get coccidia, but we get people coccidia. Chickens get coccidia, turkeys get coccidia. The problem is they get a bunch of them. They get like 7 of them. And it really can cause devastating disease in the birds. And they need to become immune to all the varieties individually. And then their immune system deals with it, and they get that persistent asymptomatic carrier state just like the other diseases we've been talking about. This is the reason why you feed that starter feed when you get your baby chick. You want to make sure that you are providing a little low level of medication called a coccidiostat. And what that medication does in your chick is it decreases the shedding of the coccidia, but not completely eliminates it, because you want the bird to have a controlled exposure to this protozoal parasite so that its immune system gets used to it. But this is a disease that I see cause devastating problems if birds are mixed from one flock into another flock where maybe the original flock has never been exposed to a coccidia that the new flock carries, because then they get stressed out when they're mixed together. You get shedding of this protozoal parasite, and it can be shed in large numbers out in the feces, and it becomes infective within a day or two, and you can have some serious mortality within a flock. So this is a biosecurity one all the way, making sure you get healthy stock when you start and being very careful about mixing any new birds into your flock that might be carrying that asymptomatic disease. You guys can probably sense a trend. Okay, I just put that there. Everybody knows what the backside of a bird looks like when it looks yucky. You're always looking at the front side of your bird, but when you are working with your bird, make sure that you give it that daily check. You want to check all parts of it. You're checking your birds, you're keeping your journals, you're writing down your observations, you're charting normals. Once you get used to seeing what your bird looks like normally every day, you will be surprised at how fast you can detect something abnormal. And the earlier you detect an abnormality in your birds, the faster you can get medical care for that, and the larger chance of a successful and less expensive outcome. So keep that in mind. All right, next one on our list is the northern fowl mite. This is the most common external parasite in backyard poultry. They get a bunch of things. They get a few different mites. We're going to talk about another one in a minute. Oh, no, we're not. Actually, bumblefoot is not on my biosecurity one. So they get a number of different mites. One of them's the scaly leg mite. One of them's the roost mite. They get a bunch of different lice, a couple different lice as well. But this is the most common external parasite of poultry. And this is one that would get into your flock if you brought a bird in that had this parasite. If you start without it, it's not going to pop up spontaneously. The problem is this external parasite breeds in unbelievably high numbers. It really can breed in thousands and thousands and thousands on your bird, and it really can cause some discomfort for your bird. And then the other problem is the normal place for this mite to really cluster on your bird is the cloacal opening or the vent opening where the egg comes out. And you can actually have these tiny little minuscule mites on the egg. And while their favorite food is not people, they will chew on people a little bit. And so make sure that you are not bringing in a parasite that not only will affect your birds, that might decide to chew a little bit on a 4-H student for an alternate snack. So this is biosecurity, but in a little bit different way. I get lots of questions about what predator affected my flock. And if you think about it, inside a chicken coop is the favorite food of just about everything on the planet. You have chicken feed, you have eggs, and you have chicken. When you go to bed and you lock up your coop, every predator wakes up and they grab their lunch pail and they go to work staring at your coop, trying to figure out how they can get in there. And nothing can devastate a flock or a student or a backyard poultry keeper more than finding that some predator got in and caused problems within their flock. The prevention for that is rock solid coop security. OSU Extension has a great fact sheet that describes the different types of predators and how you can protect your flock from predators. This is biosecurity. It's not bird to bird. I'd say it's more of an indirect one, but you want to make sure that you don't have anything bad able to get into your coop. Not only is that disease, but that is also predators. So here's the mite that I was talking about, mite number 3. This is the scaly leg mite. And what this is it's this big tank-like thing. And this actually, if you were to look at lots of pictures of mites, this is what a sarcoptic scabies mite looks like a little bit too. This is a mite that proliferates underneath the scales on bird feet. And this is a worst case scenario. Hopefully it never gets to this thing. This is the only mite that can do that. But just like the northern fowl mite, this generally isn't going to pop up spontaneously out of nowhere. This would be introduced into the flock if you purchased a bird that already had this parasite and then was able to transmit this to your birds. This is why we have examinations of new birds by your veterinarian. If you purchase new birds, this is why we have quarantine, so that we can observe if there's any outbreaks for 30 days before you mix your birds together. Because what you don't want to do is buy this disease that comes into your flock, and then an infected bird would spread that throughout your flock. So I get a lot of questions about this, but I'll be super honest. I've not actually heard of any big disease outbreaks of blackhead. And what blackhead is a protozoal parasite that is transmitted by a cecal worm. And it is something that is fairly common in to be in potential. No, I don't want to say fairly common. This is something that is fairly commonly encountered on the internet when people investigate keeping turkey projects. The reason is this parasite is in chickens asymptomatic, but in turkeys it causes devastating disease. It also persists in the environment for years. And so when people investigate keeping turkeys, and I'm seeing an increase in 4-H students keeping turkey projects over the last few years, you'll read on the internet, don't keep turkeys where chickens were. And the reason is because this parasite can be shed out into the environment. It has a bird host inside chickens where it's asymptomatically carried. It actually has a different host where it can be shed in the environment and taken up by earthworms, which keeps it in the environment as well. And then if a turkey forages and encounters that either directly from a chicken that's infected or by ingesting some of the other hosts that would have that parasite in them, then they can get sick from blackhead. Blackhead has no approved treatment, and it can be fatal in turkeys. The recommended time frame to make sure that you don't have any concerns about this being transmitted from chickens into turkeys, believe it or not, is 4 years before keeping turkeys in a spot where chickens were kept, which I know can be very difficult for people to do. I don't know of any big outbreaks of this, but it is a potential worry because, like I said, you can have that asymptomatic carrier inside of a chicken and then bring turkeys in, and then they could be exposed by that. So what are our take-home points from today? Your veterinary client-patient relationship is a great thing to have in place because it's one of those things that when you need it, you really need it. And it seems like you always need it on Saturday night or Sunday when it's emergency time, where you have questions for your vet and you need to get a hold of them. And it is something that if you have it in place, your veterinarian can give you guidance without potentially seeing your pet because they already know you and they know your pet. Create a plan for routine care, meaning that you guys as 4-H livestock students, you're going to be taking care of this livestock animal. But what I encourage you to do is keep that record, keep that journal of how much your animal eats, what you're feeding it, how it's acting. In a lot of cases, it's great to to chart the body condition score and all of those things, because a lot of changes can be very subtle. And if you are working with your livestock project on a daily basis, you will really get good at knowing exactly how that animal is interacting, right? They come see you all the time. You're checking its breathing, you see how it walks. And that way, if you see something unusual, because you've been doing your daily observations and you've been tracking that, you can very quickly make a diagnosis on your own that there's something wrong going on. As we discussed, biosecurity is absolutely critical to make sure that you are not bringing disease into your flock. 8 of the top 10 most common things that I see enter into flocks can be completely prevented using excellent biosecurity. And then now that we have all the Zooms and we're using a telemedicine a lot more than we used to do that. If you have that veterinary client patient relationship in place, telemedicine is a great way for you to get a consult with your veterinarian. I used to use telemedicine when I was in practice a lot, even before it was popular, especially if I had somebody have an animal that I knew was going to try to kill me when they came into the room. And I would say, shoot me some pictures or some video and I'll see if I can't make a diagnosis looking at that. But I could only do that if I had the veterinary client patient relationship in place. So one of the things that I like to stress to students is this: there are some diseases that birds, and quite honestly, pretty much every species, believe it or not, even your dog and your cat have diseases that they can carry that can be transmitted to you. Diseases that are transmitted between species are called zoonotic diseases. There's a number of them for every species. Here's a list of common ones that are transmitted by poultry to people. None of these are ones that you would like to have. The most common one is salmonella, which we're going to talk about here in a minute. And then the other thing to keep in mind is, and 4-Hers know this, but a lot of folks that I engage in the backyard poultry community don't really have as deep of an understanding of is poultry are food animals, right? When you have your chickens and your turkeys, those are food animals. And a lot of folks that are new to keeping birds, they can think of them a lot more like pets. But we do have some limitations because they're food animals, and that is we don't have as many drugs as we would be able to use in other species that are non-food animal, because we have to make sure that we're practicing great withdrawal times so that we can practice residue avoidance. I tell a common story that if you walked into my clinic and you had in one hand a parrot, in the other hand you had a chicken, and they had the exact same disease, I have a bunch of different medications I could use to treat the parrot. I have very few that I could use to treat the chicken, even though they're both avian and both of them have the same disease. And then the last one that I want to stress is a biosecurity between your livestock and you as 4-H students, and that is there are some diseases that poultry can keep and they have inside them that are asymptomatic in the birds and cause no disease in the birds, but can cause disease inside the people. And one of those is salmonella. The variety would be Salmonella enteritidis. This is something that can be shed in the feces of the bird. This is something that actually, if they're infected, they can have inside the egg, meaning even if you wash that egg, it's still inside that, which is why if you go to a restaurant, the menu says we recommend fully cooking your hamburger and fully cooking your eggs, because they want to make sure that there is no chance of any disease in there. But we do see people still snuggling baby birds, which I'm all in favor of. Just make sure you wash your hands. But we do have folks that are kissing baby birds, or they're giving them their own little bird bedroom in their house. I've had that happen multiple times where people tell me they have a bedroom in their house and that is where their chickens live. Keep in mind that there is a potential transmission for disease. A lot of people that keep birds in some of the weirder places in the world, I guess I would not in any way, shape, or form ever keep birds in the bedroom, the bathroom, the kitchen, or the living room. But most of those folks were aware that there is potential disease transmission. So make sure that you practice great biosecurity on your own so that your birds are not indirect transmitters of disease into you. And above all, don't kiss your birds, because your birds don't want to be kissed. That is something I know. Or maybe they do, but still don't do it anyhow. All right. Laura, if you guys want to get your next round of attendance, or however you want to do that, we have saved just a little shy of 15 minutes if we have any questions from the students.
Sure. Well, I've been observing. I would like my Henry County kids to kind of hang on, you know, when we do finish recording, or have some question answer session here. So if you want to ask Dr. McDermott a question, you can either type it in the chat box, or you can unmute yourself and ask your questions. Watch the chat box.
Wesley, I see your hands raised. What? You go ahead and unmute and ask your question.
Okay, so I am taking turkeys, but I think this may be helpful. I was having this problem with my chickens. So my chickens, they're just starting to lay, but there was there's pretty much like no shell on it. It was just like that leathery stuff. What
So
was that? Because
it is not uncommon.
A, I don't know, and two, I think it may be helpful for everyone else.
So I will say that when a chicken comes into lay for the first time, it's not uncommon for some abnormalities early on in their reproductive cycle to happen.
Okay.
Fairy eggs, no
Okay.
shell, just some oddities that way. If it persists, then that would be a worry. And you also want to make sure that you move them off of sort of that grower feed into layer feed if they are, as soon as they start moving into laying, because they use a tremendous amount of calcium, a layer does, when they create an egg. And if they don't have enough calcium in their diet, they will try to continue to lay eggs, but they will actually pull the calcium out of their bones, and that can cause a serious nutritional disease. Easy way to identify which chicken is eating the eggs.
Yes.
I guess the easiest way would be to just grab a flashlight and just head in the coop and set an alarm for 4:30 in the morning and just be watching to see who's doing it. Other than observing them, that's really hard to say, quite honestly.
So it's a deficiency, but you're not able to tell by a visual inspection. I mean, I separated them
Mm-hmm.
and and finally figured out who it was, but
Mm-hmm.
there's no other way to do that.
No, I don't know of one offhand. That would be the best way, right? Separate them and see who is leaving eggs alone and who's messing with it, because they might eat their own eggs or they might eat somebody else's eggs. And so it does take a little bit of work. And then in some cases, if they're persistent that way, they actually recommend culling them, because that's a habit that you don't want in there. Webcam, that'd be great. You could do one of those motion sensor webcams, or like a Nest.
The problem is it's dark when they're doing it and the webcam doesn't pick it up.
Oh, well, that sounds like flashlight and sleeping bag to me.
Yep.
Put your camera out there.
Nikki asks, how likely can a bird get a disease? Their chances of getting a disease is very similar to any other species, right? If they're maintained on a high plane of nutrition, if they're kept in a really healthy environment and they get a great healthy start, that allows their immune system to develop, and then they kind of minimize any potential exposure to other diseases, there's a really good chance you can avoid disease in your birds.
I have a question about waterfowl. So this is our first year in 4-H and we're doing ducks. We have pecans. I was reading that they can become deficient in vitamin B. What should we be looking out for to see that they are? Because we bought some like electrolytes from the store in a packet. We could mix in their water, but I'm not sure when to use that, or if we have to. I'm not sure what to look for.
Are you feeding them a labeled duck feed?
No. So we have just, it's like a mixed flock starter.
Okay. So I guess there is a little bit of nutritional requirements that are different, even within sort of avian subspecies, from chickens to ducks to turkeys. And I would, I would try to find one that's labeled specifically for ducks, if you can find that, which can be difficult. It's becoming a little easier because people are starting to keep those different species now, which is really, really cool. But that's what I would recommend. And then if you can't, and you're looking to find sort of a good diet for a different species in there, when you're on the internet and you're doing your search terms, like, keeping market ducks or something like that, at the end of your search term, type the word extension in. And what that does is it will eliminate a sort of a lot of the websites that are just trying to sell you product, or social media sites. It will bring up only research fact sheets from land-grant universities that have extension, and that way you'll be able to find a research-based diet that you can make sure that your ducks are getting the that high plane of nutrition. Because yeah, you can have a hypovitaminosis D or any other things if you don't have a diet that is specific to intended use of the bird. And birds, especially layers, that is mission critical, because there's a number of different nutritional abnormalities when you have a bird that is going to do something, right? Like lay eggs or come into that production level, that if their diet plan is not matched for their individual production use, they can have a serious disease as a result.
Do they display like any type of signs that we would be able to see or look for to see if they're deficient?
Unfortunately, the majority of nutritional imbalances manifest themselves at the end when they're bad, because they're so subtle until they get bad, if that makes sense. It's not like there's not like a chronic pain, like they all of a sudden are fine and then they're limping and it's an acute presentation. Almost all nutritional imbalances have a chronic presentation. It can take a while for that to build up, and then generally in a lot of species, animal species, they then try to hide presentation of disease, especially when they are potential predator items, you know what I mean? And so all of the various nutritional imbalances can have a manifestation of disease, and I would have to do some more research on hypovitaminosis D in ducks. But the problem that I would be worried about would be that by the time you saw something, it would be so far into the disease progression that you would have a concern.
Okay, thank you.
Sure.
Tim, there's a question in the chat box.
Okay.
How do you tell, there's several questions actually. How do you tell if a chick is a boy or a girl?
I have no idea. I mean, no, I know exactly. I have an idea. Sexing baby chicks, especially when they're very young, is extraordinarily difficult. And any of the, there's actually people that at the hatcheries can do that. And there's some interesting online publications to try to teach you how to do that. My old man eyeballs are not good enough to see at that level anymore. But then as they mature, they do develop different characteristics that are going to tell you if you have a hen or a rooster down the line. And by that point, you already have them, which is why they have what's known as sex linked. If you go into, say, Tractor Supply or Rural King or any of those places, you're going to have your, we're coming to the tail end of chick season now. I was in Tractor Supply a couple of weeks ago and they still had a decent selection of them, but they have straight run, 4, 5, 6 different things, some meat birds, and they got some layers, and they might have a show bird or something like that. And what they also had is straight run. And what straight run is they have found that if there are certain breeds that they breed together, because their genetics are different in avian than they are in, say, human, they will come out as a color, and the color will tell you what sex it is, which is the only way that when they get those bulk birds like that from a hatchery, that you're getting a hen. Other than that, if you buy 10 birds, you get what you get and you don't throw a fit. You might have 10 roosters, you might have 10 hens, you might have 5 and 5, hard to say.
So
All right.
another question, how do you treat mites?
So you treat mites by first making a diagnosis of which one it is, and then there are a number of over-the-counter products that you can get, and then there are some products that you can get from your vet. But the key to any treatment of external parasites is making sure that you've diagnosed which one it is, because a lot of them can kind of cause similar symptoms.
Okay.
And then when you have your veterinary client-patient relationship from your veterinarian, they can guide you on exactly how to treat the mites. All right, so we got a bunch of questions.
Yeah,
actually.
next question is, can you also eat chickens that lay eggs?
You bet you can. So there are some breeds that are super elite at their individual thing, right? You can have, like the leghorns, the white birds are elite egg layers. And then there are birds that are elite at being meat birds. But then there's what's known as dual purpose birds, which is a lot of the birds that folks get, that would be like Buff Orpingtons or Buckeyes, Americanas, any of those things. They will actually produce eggs very well for a couple few years, and then they will be at a harvestable size that they could then be a meat bird at that point. So dual purpose do actually both of those. They're not outstanding at egg layers like a leghorn, which is an egg laying factory. They're not going to reach the harvestable size as rapidly and as efficiently as a meat bird would be, but they do good, and a lot of people keep them for that exact purpose.
So.
All right, so
Next question, can you see that there? When you're raising meat
yeah,
chickens.
I can go.
Oh, okay, great. Okay.
Yeah, I can go
for it.
flying through them here.
Great,
That way,
okay, great.
we're at 6:58, but I always like getting through the questions. So we're doing speed question round, gang. So when you are raising meat chickens, when do you stretch from beginner feed? I like to feed starter feed for about 6 weeks. That's their time in the brooder. And then I'm going to move them for probably that next 4 to 6 weeks or whatever onto a grower or finisher feed. Is it likely for one of your chicks to die or get hurt a few weeks after you get them? Yes, actually, just like any other species, their most fragile time is when they are the youngest. They have not developed a complement immune system. They are just growing that way. And I would say that with any species, and that's baby chicks, that's baby kittens, that's baby people, that is a fragile time where they need the most care. How do you tell if a duck is a boy or a girl? I'm going to pigeonhole that one, no pun intended, back with the chicken one. I'm not good at it. Can you keep broilers and meat pen chickens together? Sort of. It depends. If you buy them all at the same time, possibly. But keep in mind that when we talk about meat birds that are grown specifically just for meat, they are harvested as chicks, right? You harvest a meat bird at like 2-3 months of age. They're basically still chicks. I don't generally recommend that you mix different uses that way simply because they're different ages, which means their immune systems are at different levels. All right, we did the starter feed to the adult feed. The starter feed goes to about 6 weeks, and then meat birds are going to harvested way before they would come into lay. Layers come into lay around 20 to 22 weeks, where you would transition to a layer feed. All right, I'm going to tell Laura Rolfe, you need to hold a class on sexing one-day-old baby chicks and ducks, because we have some serious interest in these 4-H students on knowing if they're boy or girls.
Maybe we could get somebody from Cooper Farms to come in and show us how to do that.
That would be cool. I would attend it. So invite me if you get that.
I think I know how you can tell like a male chicken between a girl one. They kind of like this, I don't remember what it's called, but they have like this extra toe above their back for males. Well, that's from the past chickens I've had. I don't know if that's for sure or not, but the chicken I have, they had that.
Cool, thanks. So Weston asks, why in Ohio do you have to buy 6 at a time? I have no idea. I only learned that in about the last year or so. The 4-H director, Kirk Bloor, asked me if I could think of any medical reason that would be for 6, and I couldn't think of one. That is a very unusual line in regulations on that, and I think they're going to take a look at that, but don't quote me. Parker says, can chickens in my house? Oh my goodness. Is a chicken mite the same as a spider mite that you find on plant? No, Nikki, they're not the same, although they're in the same sort of taxonomic family. Cousins we'll say they're cousins, but they eat different stuff. Why do toms peck each other? Boys, that's all I got to say. Why do boys do anything that they do? They're actually establishing, right, the pecking order. There's lots of different phrases that you find in everyday vernacular that came out of raising chickens, right? Broody, pecking order, all of those things were from observations when basically everybody kept chickens. You go back 100 years ago and everybody had birds that they kept for meat birds and for eggs, pretty much. Brooke, as much as I would love to discuss treatments on any kind of medical diseases, unfortunately, since we do not have a veterinary client-patient relationship, I cannot give you any guidance.
I have a question about, so if we got a straight run, right now we can't tell what's boys, what's girls, but as they get older, if we end up with more drakes, I heard that they should have like 6 females per 1 drake. Should we separate them then if we end up with like more boys than girls so they're not so hard on the females, or?
Probably a good idea. Yeah. Are you planning to keep all of them regardless, or were you going to have some of them be meat birds, or
No, we got 6 just in case we lost some,
okay.
but we're going to take 2 to market, and then do 2 in the fancy, but we were just going to auction off the ones that didn't go to market.
Mhm.
But in the meantime, I wasn't sure if I should separate the males from the females if we got like just too many boys.
Yeah, I guess I would do close observation, and I would have a place to separate them ready and see how they do. They might grow up fine because they've all sort of stayed in that group, but you will find that there can be some behavioral changes pretty much with any species when they come into sexual maturity in terms of how they interacted prior to that.
What age should we expect that?
Probably as you get maybe between 3 and 6 months down the way.
Okay.
You might see it, you might not. So I hate to predict the future, other than I like to say plan for it. And that way, if you need to make adjustments, you can make them quickly. All right.
I have a
Sure.
question. So my rooster has like an extra toe. Is that recessive gene?
That's what I was
I
touching on about how you tell the male from the female.
am unfortunately, it is breaking up very much in the question. I think I heard rooster extra toe.
Yeah, that's what I heard.
Yeah. That a recessive gene?
I don't know. I guess I don't know my rooster genetics to that level as to whether it would be a recessive gene or not, or a dominant one. Probably recessive, I would say, or else we'd see some crazy different things that way.
That's what I was saying. How with my roosters, I had the extra toe too. How I said that's how I think you can tell them apart. I don't know for sure.
There's a couple-
Carmen asks, and I was gonna say
Go-
we'll come at the last one, and then we're gonna wrap up. Do ducks take dust bath like chickens? I found they don't do it as much as chickens do. And will chickens and ducks fight if they come in contact? Maybe. I would definitely recommend that you don't mix your different species together, simply so you don't. That is one of those things that when we talk about like biosecurity worries, because different species can carry disease and have it be asymptomatic, and they can then transmit that.
All right. Yeah. So, Dr. T, I think there was a comment there about the spur, not an extra toe. That's what I thought they were referring to as well, but.
I thought so too. I'm Wesley, you're breaking up pretty good. I'm having a tough time hearing you.
Okay. All right. Well, if we don't have any more questions,
Can you hear me now?
it's still pretty hard.
Remember what it is.
Okay.
Sorry, my sister's on nurse.
Okay. All right. So, Dr. McDermott, thank you so much. We really appreciate you.
My pleasure.
being here. Yeah.
You guys brought some great questions.
Yes.
I'm really excited to see the resurgence in not only keeping poultry projects like chickens, but more ducks and more turkeys and just more interest that way. I think it's a great way to continue to keep a livestock project that doesn't necessarily have the space needs or the expense of some of the larger ones. And I'm really hopeful that we have, you know, the fairs for people to actually have the fair experience too.
I think it's going to happen. So, okay, I'd like Henry County kids to stay on for just a couple seconds once I turn off the recording. And Gigi, do you need anything? I know Francis had to get off. You're good?
No, we're good.
Okay.
I've got all the information and I will send it out to each one of the educators so that they have it, the pictures too.
Okay.
Otherwise, Claremont, thank you for joining, and Defiance, Williams, Madison, the whole realm. Thank you guys for letting the Southern County join in with you Northern people.
Well, and we now officially have about, I don't know, probably half an inch to an inch of snow on the ground.
That's about all we're supposed to get down here. So nothing started yet.
Laura, it's still 55 and sunny outside
Okay.
in Columbus.
Gee, thank you. Yeah, it's sticking to the trees. It's gonna be gone by tomorrow afternoon, but yeah. So, okay.
Emma,
Thank
tell
you.
Grandpa hi. I see him jumping in and out.